When the brain is in catastrophic trouble, it can't always use words to send out an SOS. Instead, it sends a signal through the body itself. It's this silent, urgent distress call. Today, we're going to decode what the body is trying to tell us in these incredibly critical moments, and what these signals reveal about the brain's desperate fight for survival.
Really think about that for a second. A signal so primal, so involuntary, that it completely bypasses conscious thought. This is a very real, very profound neurological reality that medical professionals have to interpret in a matter of seconds, and it tells them almost everything about what's happening deep inside the brain. So what we're talking about here is something called pathological posturing. We're going to focus on two specific types, decorticate and decerebrate posturing. Trust me, these aren't just random movements. They are powerful, involuntary responses to severe brain injury, and they tell a story that is absolutely critical. Yeah, so that's the main thing to get here. These aren't spasms or seizures in the way you might normally think of them. Nope. They are highly specific, almost stereotypical postures that give doctors a massive clue about what's going on inside the skull and, this is the important part, where the damage is located.
Okay, so to understand these signals, you first have to be able to tell them apart. And it really all boils down to one key difference. Are the arms flexing inward or are they extending outward? Let's break down exactly what each of these postures looks like. First up, we have decorticate posturing. So picture this. The arms are pulled up super tight to the chest, almost guarding it. The wrists and fingers are flexed, and the hands are clenched into tight fists. All the while, the legs are held rigidly straight. This is what's known as abnormal flexion. Now, let's contrast that with decerebrate posturing. Here, it's like everything is extending away from the body. The arms are straight and rigid down at the sides, the head and neck are arched way back, and the legs are straight with the toes pointed down. This is abnormal extension. This chart here really lays it all out side by side. So you can see both have extended legs, right? But the real giveaway is the arms, flexed to the chest in decorticate and extended at the sides in decerebrate. And you really want to pay attention to that last row. Decerebrate is considered the more severe and, frankly, the more ominous sign.
If there is one thing you take away from this that helps you remember the difference, let it be this right here. This is a brilliant little memory trick that med students use all the time. Decorticate, the arms go to the core of the body. It's a super simple way to instantly tell them apart. So why the big difference, right? Why do the arms flex in one and extend in the other? Well, the answer lies deep within the brainstem, and it all revolves around this tiny but absolutely crucial structure.
The easiest way to think about it is like this. Your higher brain, the cortex, is constantly putting the brakes on all these primitive reflexes that live down in your brainstem. A severe injury is like someone just snipped those brake lines. And the exact posture you see depends entirely on where those lines were cut.
Okay, let's walk through this because it's fascinating. Deep in the midbrain, there's a structure called the red nucleus, and its job is to control arm flexion. Now, if the injury is above the red nucleus, the brain's brake system is gone. But the red nucleus is still firing off signals, so its flex command just runs wild, and the arms flex. That's decorticate. But if the injury is at or below the red nucleus, that whole flex signal gets knocked out completely. And now, even more primitive pathways from lower in the brainstem take over, and they cause this powerful extension everywhere. And that's decerebrate. It's a devastatingly clear sign that the damage has gone deeper into the brain.
So understanding the how is one thing, but what actually causes such devastating injuries? And what does this signal mean for a patient's chances of survival? This is where the reality gets pretty sobering. This kind of severe brain injury can be triggered by a whole range of things, like a stroke, a brain tumor, even a profound lack of oxygen. But as you can see right there at the top of the list, the single most common cause, by far, is traumatic brain injury, or TBI. And the scale of this problem is just staggering. An analysis estimated that about 69 million people worldwide suffer a TBI every single year. That's the population of a large country. It just highlights why understanding these warning signs is so incredibly important. And this chart right here, well, it illustrates the clinical stakes perfectly. For patients who have a severe head injury and show decorticate posturing, the survival rate is around 37%. But if that posturing progresses to decerebrate, the rate plummets to just 10%. This isn't just a sign, it's a stark indicator of what's likely to happen next.
So let's bring this all together.
what should we really take away from this profound and, frankly, frightening signal the body sends us? The most crucial point to remember is that these postures aren't a disease themselves. They're a sign. They're an alarm bell, a siren, screaming that the brain is in an absolute crisis. Watching a patient shift from decorticate to decerebrate is one of the most feared signs in all of neurology because it often means the brain is herniating and moving closer and closer towards brain death.
And that brings us to our final thought. We now understand how to read this distress call. We know it signifies a crisis that's already in motion. So the real question becomes, what can we do to prevent the kinds of traumatic injuries, the car accidents, the falls, the things that happen every day that so often send this terrible signal in the first place? And that's a question that moves us beyond the hospital walls and really into the realm of public health and prevention for all of us.